Hello everyone, I am Dr. P. Thilages, Assistant Professor, Department of Pharmacy Practice, Sri Sanmuga College of Pharmacy. Today we discuss about what is known by psoriasis, is eczema, and understanding the difference. Both are skin disease. The how to analyze the symptoms of psoriasis and the symptoms of eczema. How to determine, how to analyze, how to treatment of choice in the psoriasis is eczema. We will discuss about psoriasis and eczema. What is psoriasis and what is eczema? What are the signs and symptoms of psoriasis and eczema? How to determine the both are skin disease? How to treatment choice? How to choose the treatment choice? And finally, we should analyze the what is the difference between psoriasis and eczema. First of all, psoriasis is eczema. It is the understanding difference between psoriasis and eczema, delving into two common chronic skin disease. Both are the chronic skin disease. It is not acute skin disease, it is a chronic skin disease, and exploring the unique characteristics and causes and management strategies. What is the causes of psoriasis and eczema? What is the management strategies in the psoriasis and eczema? We will see in another slide. What are psoriasis and eczema means? Psoriasis is the autoimmune disease. Autoimmune disease causing rapid skin cell buildup, leading to thick and red patches with the silvery scales. You will see the image. This is the psoriasis, and it primarily affects adult and driven the overactive immune system. It is the autoimmune disease. What is mean by autoimmune disease? The person's body attack own immune cells. The person's body attack own immune cells. That is called autoimmune disease. It is the what is the main focus of skin disease means autoimmune disease. Autoimmune disease is the person's body attack own immune cells. It is the autoimmune disease. Next one is eczema, and also it is known as atopic dermatitis, a condition where characterized by the inflamed and itchy skin and dryness of skin, and often due to the compromised skin barrier and the dysfunction of the skins. It is frequently appear in the childhood days. What is the culprits and causes and triggers? Psoriasis. First of all, we see that psoriasis genetic predisposition often runs in families and indicating a strong genetic link to eczema. Immune system dysfunctions. T cells mistakenly attack healthy skin cells, accelerating their growth cycles. First of all, what is the T cell is the WPC cells, T lymphocytes and P lymphocytes. It is a main focus on the prevent from the any infection. In our body have the antibodies. In our body have the antibodies. It is main role of antibodies means any infection enter in our body, that antibodies fight to the antigen or microorganism. Trigger stress, infection and strep throat, the skin injury, and certain medications and the cold weather and the smoking can exacerbate flare-ups. Eczema is the genetic factors linked to the variation in genes and affecting skin barriers such as the filaggrin and environmental irritants, soaps, detergents, allergens, and pollen, and dust and mites, and a pet tender and certain food can trigger the symptoms. What is the immune system overreaction means? An abnormal immune response to environmental factors leads to the infections. Visual characteristic of both psoriasis and eczema. Spot the difference under psoriasis. It is a thick scaly patches. You see the thick scaly patches and characters with a well defined and raised red lesions covered with a silvery white scale, and these plaques commonly appear in the elbows, knees, scalp, and lower back. Nail involvement. Psoriasis can affect the nails and causing pitting and discoloration, thickening, and separation from the nail bed, and this can be telltale sign. Next one, defined border. Psoriasis patient have the lesions that typically have sharp and distinct borders, differentiating them from the surrounding healthy skins. And also eczema means red and itchy rashes. Eczema manifests as the red and intensely itchy patches that can be dry or scaly or oozing, and scratching can lead to the further inflammation and infection. Next one, dry and cracked skin. The skin affected by eczema is often very dry and leading to cracking, especially in the areas prone to the movement like joints. This can increase susceptibility to the infection. Location commonly found in skin folds such as the inner elbows, begin and knees on the neck and wrist, ankles, infants, and often appears on the face and the scalp. It is the difference between the eczema and psoriasis. Next one, beyond the skin, associate symptoms and complications. Psoriasis. Psoriasis, arthritis. Arthritis means joint pain. Joint pain, stiffness, and swelling affecting up to the 30% of people with psoriasis. And also metabolic syndrome. Metabolic syndrome means increased risk of obesity, high blood pressure, and type 2 diabetics. Next one, cardiovascular disease. It is the high risk of heart and stroke. Mental health, increased rate of depression and anxiety due to the chronic nature and visible symptoms. Next one, eczema. Eczema, asthma, and hay fever often co-occurs with the other allergic conditions and a phenomenon known as atopic march. Skin infection, damage with the skin barriers make individual and more vulnerable to bacterial and viral fungal infections. The sleep disturbance, it is the intense itching and especially at night can significantly disturb the sleep quality. And also mental health, chronic itching and anxiety and depression and social isolation. These are the associated symptoms and complications. What are the mainly associated symptoms and complications? Means we have psoriasis, have the psoriasis, arthritis, and metabolic syndrome disease, or cardiovascular disease, and the mental health. And also eczema, asthma, and hay fever, skin infection, and sleep disturbance, and mental health. Simplicity. Why it is the chronic disease? It is a potential threat means if any patients have the psoriasis, in the psoriasis, uncontrolled psoriasis can affect arthritis and the metabolic syndrome disease, and cardiovascular heart and brain, any attack in the cardiovascular system and mental health. But both are in the same symptoms have the mental health. Mental health means any psychiatric problem, anxiety, depression, and these are all the it is the antidepressant and anti psychiatric and bipolar disorder, dementia. These are all the mental health problem. So, in the have eczema, it is affecting the asthma and the skin. It is sleep disturbance. These are the nervous disorder, sleep disturbance and the mental health. These are all the sleep nervous disorder. So, if they have the both disease, it will affect the main organ in our human body. So, it is called chronic disease. What is the diagnosis? Demystified in the clinical exam, visual assessment of sign of the skin and medical history, review symptoms and triggers, and also do the skin biopsy laboratory tissue analysis. Accurate diagnosis is crucial effective treatment and doctors typically in the combination of visual assessment and the patient history. What are the treatment approaches in the managing psoriasis means? Managing psoriasis requires the multifaceted approach tailored to the individual condition severity and lifestyle. Topical treatments. What are the drugs used in the topical treatment means? Corticosteroids and vitamin D, analogs and retinoids help reduce inflammation and slow skin cell growth. Phototherapy. What is maybe phototherapy means controlled exposure to the UV ultraviolet light can help for clear skin and often improve the widespread psoriasis. What is systemic medication in our psoriasis and eczema means oral drug like methotrexate is an anti-cancer drug and cyclosporine is an anti-cancer drug and injectable biology target to the immune system to the reduce symptoms for the severe cases. What are the lifestyle adjustments, stress reduction, moisturizing using moisturizing creams and trigger and visual components and long-term management? The treatment approach in the managing eczema is mainly affected in the childhood. Eczema management focuses on the elevating symptoms and repairing the skin barrier and preventing the flare ups. Moisturizer. Well, use the moisturizer regular and liberal application and emollients is fundamental to keep skin hydrated and repair the barrier. Topical corticosteroids used to reduce the inflammation and itching and during the flare-ups and the calcineurin inhibitors. It's a non-steroidal creams that modulate the immune response in the skin. The next one is antihistamine. Oral antihistamine can help them manage severe itching and especially at the night. And also trigger avoidance, identifying and avoiding irritants that can significantly reduce the frequency. These are the treatment approaches in the managing eczema. Living with chronic skin condition, emotional support. How to control living with the chronic skin condition? What is the first one is emotional support. Connecting with the support groups and mental health professionals can provide the valuable coping mechanism and reduce the feelings of isolation. And also self-care routines, other than to consider the skincare region and managing stress through the mindfulness and ensuring the adequate sleep and crucial. And the patient's advocacy, it is the educating yourself conditions empower the informed decisions and advocate to your treatment and healthcare providers. These are all the living with the chronic skin condition. First one is emotional support. What is emotional support means? If any situation, you have to handle it, how to do that. This is the emotional support in the healthcare professionals and other relatives or families and self-care routines and patient advocacy. These are all the overview of eczema and psoriasis. Okay, thank you.